Hey everyone, I'm Katie with Old Bull Athletics, and I'm here with Annie. She is our physical therapist, strength coach, and pelvic floor and pre- and postnatal specialist. I'm really excited to help people understand a little bit more about pelvic floor physical therapy, how many people can benefit from it, and how we can integrate it with strength training, and that's Annie's expertise. So Annie, can you tell us a little bit more about who would benefit from pelvic floor physical therapy?
Yes, you can benefit from pelvic floor PT if you're experiencing any kinds of leaking during daily activity, whether it's coughing, sneezing, high impact activities, or working out. Also, heaviness in the pelvic region, pain, or any kind of incontinence, whether it's urinary or fecal. Also, if you've been pregnant, you may want to visit a pelvic floor PT just to make sure that everything has gone smoothly with your pregnancy and that you're ready to get back into activities of daily living and strength training if that's your goal. Or if you're not pregnant or haven't been pregnant, you can also come in and just get any kind of questions answered, or if you want to see if there's anything that you should be working on with regard to the pelvic floor as well.
A lot of people don't realize that the pelvic floor is made of a bunch of muscles, just like the muscles that we train in the gym. So can you talk a little bit about some strategies or the similarities between how you would train the pelvic floor musculature, just like you would train a squat, a deadlift, a bench, anything in the gym?
Yeah, so like Katie mentioned, the pelvic floor does consist of just a bunch of muscles that you can't see, so a lot of time people have a hard time making that mind-body connection. But just like how you would train your quad or your knee, if you have any kind of knee pain, by starting at a safe starting point and then progressively overloading. It's the same thing with the pelvic floor muscles. You can stretch them, you can definitely load them with strength training. And you want to make sure that just like any other strength training program, your pelvic floor program has progressive overload.
Yeah, so just like any type of strength training where we're trying to find an entry point for where you're at that day or where you're at based on injury history or current pain that you're having, that's what Annie specializes in with the pelvic floor. I think what's been really helpful as a colleague, there's a lot of instances when potentially just traditional musculoskeletal explanations for pain don't always explain some of the symptoms that people are still having. So for example, if you're working with somebody who has low back pain, and there are some symptoms that are more related to kind of what Annie was talking about, feelings of heaviness in the pelvic region, feelings of pain in the pelvic region, things that aren't necessarily explained as much by some of the orthopedic tests that we do in non-pelvic floor physical therapy. That's been a huge bonus for having somebody with your expertise on staff with us. Can you explain what kind of things you're looking for to maybe differentiate, okay, is this person's back pain from something that would be more orthopedically explained, or potentially there's something going on with the pelvic floor?
Yeah, so there's different tests that we run through to make sure that we screen out the low back, the hip, or any other potential tissue that could be affecting what you're experiencing. And then once we run through those tests, if we're not able to provoke or find the symptoms that you've been feeling, then I would go in and do a little bit more of a pelvic floor specific examination, and then that can really tell me whether it's pelvic floor specific or something else like the low back or the hip or something of that nature.
So a lot of women, and I'm sure you run into this with the evaluations that you do, but there seems to be this kind of consensus that, if you've given birth, if you've had children, if you've been pregnant, that potentially incontinence and leaking is just it is what it is, it's going to happen. And a lot of women are told to just expect that and kind of get used to it. As a pelvic floor therapist, can you talk a little bit more about maybe why incontinence or leaking after childbirth, after pregnancy, doesn't just have to happen and there's strategies to overcome it?
For sure. So one thing about incontinence and leaking after pregnancy and postpartum is that common does not equal normal. So just because you've had a pregnancy, you've had kids, whether it's 2, 3, 4 kids, as you're getting older, that doesn't mean that you have to live with this situation. There's definitely things that we can do that can help resolve your symptoms and work towards you being able to do your different activities or working out without these signs of incontinence.
Awesome. Yeah, and I think that's just really aligns with everything that we do at Old Bull. We're really proud to often be the providers who get to dispel some myths or maybe misinformation of maybe what other providers have told you or what you've heard online or what you've heard among social circles. And when it comes to anything with the pelvic floor, there are strategies, there are solutions, and especially having somebody who understands the relationship between strength training, endurance training, any type of physical activity, and how you can incorporate pelvic floor therapy within that. So can you talk a little bit more about how you blend your expertise of strength and conditioning with pelvic floor therapy? So like, for example, this is a pretty common thing because you work with a lot of very active women who have gone through, their pre and postpartum care with you. So let's say we have an awesome, strong CrossFitter, and she's, a year postpartum, and she's getting back into lifting, and she's been lifting all throughout her pregnancy with you and after pregnancy, but she's still experiencing some pelvic floor discomfort, and especially issues like with bracing. How would you combine your expertise with strength and conditioning and performance with your expertise in pelvic floor therapy for this person?
So it's all about finding a safe entry point for that person. So just how it would be for any other orthopedic condition, we would see what they can tolerate. For example, if they have issues with double unders or a clean, well, I'm going to break down the movement, see where it is that they're having their symptoms, and then we'll start there, and then progressively overload. Start with different exercises for the pelvic floor, whether it's lengthening, strengthening, and then incorporate those principles into their training program.
Yeah, and again, it just kind of comes back to like all training and all strengthening is the same. It's based on progressive overload and finding that entry point day one so you can start working in a zone that's going to create a positive adaptation but not push somebody too far. So what's been really helpful for me as somebody who gets to work alongside you is learning more about how you can cue and educate people for bracing and breathing during lifting. This is something that I would argue that even without like the presence of pelvic floor symptoms, a lot of people could benefit from learning a little bit more about. I know just from what we've talked about with the type of bracing or the sensations that you should feel when you're bracing and breathing made me even think like, oh, okay, there's probably some room for me to address this with my clients too and myself. So can you explain a little bit more about how you would approach the conversation of bracing, breathing, like creating intra-abdominal pressure with somebody who potentially has pelvic floor dysfunction or issues?
Yes, so the number one thing is I want to make sure that it's not too complicated. A lot of people get confused. When should I breathe out? When should I breathe in? How should I brace? Should I hold my breath? Should I not hold my breath? And there's different strategies for different lifts and different exercises that you do, but I will look at specifically what the movement or the lift that you're doing, and then depending on the load, how many reps, how many sets that you're doing, I'm going to give you a specific set of breathing strategies. So whether it's, exhale on the effort, which is the one that we are most commonly using, or there are some instances where you do have to Valsalva, and so then I'll teach you how to properly do that without putting increased pressure on the pelvic floor while you're doing it.
Awesome. Yeah, that's so helpful because I think bracing and breathing can go in a couple directions. We can just forget about it and not think about it at all, or we can get so hyper focused that it now becomes like you can just watch people only thinking about their breathing and bracing, and then they have a hard time even executing the lift.
Right.
So that happy medium of like how much information to give versus, okay, let's just let them explore a little bit more. That's awesome.
And that too, like you don't want to constantly be thinking about, okay, am I breathing in, am I breathing out? Because then that takes away from your lifting experience. So we want to try to find the simplest cue or the simplest change that we can do at the beginning, and then over time your body will adapt to that, get better at it, and then we can progress. Just how we progress any kind of exercise, we can progress your breathing strategy as well.
So when it comes to pelvic floor physical therapy, there's kind of two different approaches that you can take to an evaluation. There's an internal exam that you can perform, and you have to be specifically certified as a pelvic floor therapist like Annie is to be able to perform internal exams. And then we also have external exams. So we have a private treatment space that's available for internal and external exams, but can you explain some of the differences between the two, and potentially if somebody's maybe not ready to try an internal exam, all of the things that you can still start with to help that person, and then potentially over time, if it's something that you think is warranted, you can discuss with them?
So with the external exam, it consists of me really just going through a general screening of your entire body to rule in or rule out anything that may be going on. I'll look at the low back, the hips, and the lower extremity. I'll also just be palpating different regions of your body to make sure that everything looks good. I like to start with the external exam so people feel more comfortable. Not everyone needs an internal exam, so I like to use that as a tool rather than something that I need to check off my list when I'm working with people with pelvic floor related issues. The internal exam, like Katie mentioned, we have a private room in the back, and then I walk you through every step by step, making sure that you feel comfortable every single step of the way. And the internal exam is, again, just another tool to use to give us more answers, but it's definitely not something that has to happen or that has to be done if the client or the patient doesn't feel comfortable.
Yeah, so there's a lot of opportunities to just like, again, it kind of comes back to what we do at Old Bull, and it's all about you, and it's all about finding exactly what you need that day and exactly what you need to get you to your goals. And it's not going to look the same for everybody, but we're really excited and proud to have Annie on the team to be able to provide us with this expertise and this extra level of care that frankly I don't think a lot of women are exposed to, understand the importance of, and understand how accessible it is. There's so many things that we can miss if we're just treating somebody you know, a little bit more from the outside perspective and not diving into exactly what they need. We also, there's a lot of stuff that I think women are just told that, again, should just be expected with being a woman, giving birth, going through labor, going through vaginal or C-section delivery. There's a lot of stuff that we just kind of get told like it is what it is. So being able to have somebody on our team who can support women through the very exciting and challenging and changing times of pre and postpartum care is really special to us. If you have any questions at all about pelvic floor physical therapy, you can call us and we can give you more information about working with Annie.